The United States has been the epicenter of a public health catastrophe, a crisis born from a perfect storm of scientific discovery, corporate greed, and social vulnerability. This is the story of the opioid crisis, an epidemic that has claimed hundreds of thousands of lives and shattered countless families and communities. More than just a story of drug abuse, it's a complex autopsy of a nation in pain. Today, we're dissecting how this happened, its devastating impact, and the ongoing struggle to find a way forward. It began, paradoxically, with good intentions. In the late 1990s, a movement called PAIN, as the fifth vital sign, pushed doctors in the United States to treat patient pain more aggressively. Into this new environment stepped Purdue Pharma with a supposed wonder drug, OxyContin, a controlled-release version of oxycodone. The company launched a massive, deceptive marketing campaign, famously claiming the risk of addiction was less than 1%. This assertion was based on a flawed, misrepresentative study. They promoted this lie heavily to doctors through medical journals, educational courses, and a vast army of sales reps. Purdue even hosted all-expenses-paid symposia for healthcare professionals at resorts. An internal email from Richard Sackler in 1996 revealed that doctors who attended these programs wrote more than double the number of new OxyContin prescriptions compared to those who didn't. The financial incentive was enormous. In 1991, 76 million opioid prescriptions were written in the U.S. By 2011, that number had exploded to 219 million. By 2010, enough opioid prescriptions were being filled to medicate every single adult in the country around the clock for a month. That same year, pharmaceutical companies generated $11 billion from opioid sales alone. The stage for the first wave of the crisis was set. So what makes these drugs so powerful and addictive? To understand that, we have to look inside the human brain. Opioids hijack the brain's natural systems for pain and reward. They bind to specific sites called mu-opioid receptors, which blocks pain signals. But critically, they also trigger a massive flood of the feel-good neurotransmitter, dopamine, in the brain's reward center. This creates an intense feeling of euphoria. Your brain is wired to repeat behaviors that feel good, and this intense pleasure is a primary motivator for repeated use. With continued exposure, the brain begins to adapt, leading to two crucial phenomena: tolerance and dependence. First, tolerance. The brain's opioid receptors become less responsive to the drug. This means you need higher and higher doses to get the same pain-relieving and euphoric effects. This escalating use dramatically increases the risk of a fatal overdose. Second, dependence. Your brain chemistry actually changes to function more or less normally only in the presence of the drug. When you stop taking it, your system is thrown into chaos, leading to a host of intensely unpleasant withdrawal symptoms: severe anxiety, muscle aches, insomnia, sweating, and gastrointestinal distress. People continue using not just to chase a high, but to simply avoid the agony of withdrawal. Long-term, chronic opioid use can lead to more profound changes. Neuroimaging studies show volume loss in certain brain regions and impairments in memory, attention, and decision-making. The brain's reward circuitry becomes so rewired that the ability to feel pleasure from natural rewards, like food or social interaction, diminishes. This leaves the person feeling empty and depressed without the drug, fueling the cycle of addiction. The part of your brain responsible for impulse control and rational decisions, the prefrontal cortex, also becomes compromised, making it incredibly difficult to resist the powerful cravings. The crisis itself unfolded in three distinct and increasingly tragic waves. The first wave, from the 1990s through 2010, was ignited by that surge in prescription opioids like OxyContin, Vicodin, and Percocet. Between 1999 and 2010, as sales of these drugs quadrupled, the rate of overdose deaths involving them doubled. Many people who became addicted started with a legitimate prescription for pain. The second wave began around 2010. As authorities started to crack down on overprescribing and Purdue Pharma reformulated OxyContin to make it more difficult to crush and abuse, The pills became harder to get and more expensive. Many individuals who were already addicted turned to a cheaper, more readily available alternative: heroin. An estimated 80% of people who used heroin first misused prescription opioids. This initiated a rapid increase in heroin-related overdose deaths and new risks, like the spread of HIV and hepatitis C through injection. Then came the third, and by far the deadliest wave, starting around 2013, the fentanyl catastrophe. Illicitly manufactured fentanyl, a synthetic opioid 50 to 100 times more potent than morphine, began to flood the drug supply. A lethal dose of fentanyl can be as small as 2 milligrams, the equivalent of a few grains of salt. It's often mixed with or sold as heroin, cocaine, or counterfeit pills, meaning users often have no idea they're taking it. This is what has driven the catastrophic increase in overdose deaths we've seen in recent years. But this isn't just a story about drugs and brain chemistry. It's a profound social problem. The crisis has not affected all communities equally. Rural areas, and in particular the Appalachian region, have been disproportionately devastated. Many of these communities were ravaged by the economic decline of industries like coal mining and manufacturing, leading to widespread unemployment, poverty, and a sense of hopelessness. Physically demanding jobs led to high rates of chronic pain, and with limited access to alternatives like physical therapy, opioids were often seen as the only option. We know that a 1 percentage point increase in a county's unemployment rate has been linked to a 3.6% increase in the opioid-related death rate. Compounding this, doctors in Appalachia prescribed opioids at much higher rates than the national average, sometimes 5 to 6 times higher, due in part to aggressive pharmaceutical marketing and a lack of specialty care. And while the early face of the crisis was largely perceived as white and rural, the demographics have shifted dramatically. In recent years, the fatal opioid overdose rate among Black Americans has surpassed that of white Americans. This surge is largely driven by the influx of illicit fentanyl into urban drug markets. Systemic racism in healthcare also plays a role. Historically, Black patients have been prescribed opioids for pain less often, but this has also meant that those who do develop an addiction are more likely to start with heroin or fentanyl. Native American communities have been disproportionately affected from the very beginning, with overdose rates significantly higher than the national average, a tragedy rooted in historical trauma, poverty, and an inadequately funded Indian health service. The ripple effect on families and children has been devastating. The opioid crisis has fueled a surge in the number of children entering the foster care system. In many cases, grandparents have stepped in as caregivers, often with little support. And a tragic consequence is the rise in neonatal abstinence syndrome, or NAS, a condition where a newborn exposed to opioids in the womb goes through withdrawal after birth. In 2012, it was estimated that a baby with NAS was born every 25 minutes in the United States. The response to this crisis has been multifaceted and evolving. The federal government, though slow to act initially, passed major legislation like the Comprehensive Addiction and Recovery Act, or CARA, in 2016, and the Support for Patients and Communities Act in 2018. These laws authorized funding to expand prevention, treatment, and access to the overdose reversal drug naloxone. The most crucial responses on the ground fall into two categories: treatment and harm reduction. The gold standard for treatment is medication-assisted treatment, or MAT. This combines FDA-approved medications, like methadone and buprenorphine, with counseling. These medications reduce cravings and withdrawal symptoms, stabilizing individuals so they can engage in recovery. Studies show MAT is highly effective at reducing illicit opioid use and preventing overdose deaths. Harm reduction is a public health approach that aims to reduce the negative consequences of drug use. The most important tool here is naloxone, often sold as the nasal spray Narcan, which can rapidly reverse an opioid overdose. Widespread distribution of naloxone to first responders and community members has saved countless lives. Other key strategies include syringe service programs, which provide sterile needles to reduce the transmission of HIV and hepatitis C, and fentanyl test strips, which allow people to check their drugs for the presence of the deadly synthetic. Finally, there has been a legal aftermath. A wave of litigation has sought to hold the corporate culprits accountable. Thousands of lawsuits have been filed by states, cities, and tribes. Purdue Pharma, the maker of OxyContin, filed for bankruptcy, and its owners, the Sackler family, have been forced to contribute billions of dollars from their personal wealth to combat the epidemic. Other major players like Johnson & Johnson and even the consulting firm McKinsey & Company, which advised Purdue on how to turbocharge OxyContin sales, have agreed to pay billions in settlements. These funds are now being directed to communities to be used for addiction treatment, prevention, and recovery services. The opioid crisis is a tragic and complex American story. It's a story of scientific innovation perverted by corporate greed, of a healthcare system that failed to protect its most vulnerable, and of a society grappling with deep-seated issues of pain, despair, and inequality. The autopsy of this crisis reveals a cascade of failures, but it is also a story of resilience. It's a story of first responders, healthcare providers, community organizers, and individuals and families who are finding their way to recovery. Provisional data from 2023 showed a slight decline in overdose deaths, the first in years, but the death toll remains tragically high. The path forward is long, but it requires a sustained and compassionate approach, expanding access to evidence-based treatment and harm reduction, fighting the stigma of addiction, and, most importantly, addressing the root causes of despair, poverty, trauma, and a lack of opportunity that allowed this epidemic to take root in the first place.